thanks for clicking on this. My point today is to talk to you about why you might want to choose our clinic when you have neuropathy. And I'm going to give you about 4 or 5 reasons that I think we go above and beyond what most people do for neuropathy. The first one is nutritional therapy. A lot of doctors aren't even aware that there are certain nutritional things that, according to clinical studies, are actually more effective than the traditional medications that are used for neuropathy. And we have a list of them. We have several of them here in our office. We don't really, a lot of guys also will, the people who know about that, they'll sell you a supplement for about $100 that is really worth about 20 bucks. We give you the list. You can get them anywhere. You can get them from us. It's we don't make a lot of money off them, but the importance is that you can actually help your nerves get better, not just make them feel better by nutritional therapy. The oral therapy that is used for medications primarily just makes the nerves numb or feel better while your nerves go on dying. So nutritional therapy is a critical thing. Second thing is we have a machine called the RST Synexus, which is electrical signal therapy for nerves. It's actually been shown in clinical studies to regrow nerves and decrease nerve conduction velocities. It's a very powerful tool in alleviating neuropathy pain in about probably 80% of our patients. We have about an 80% success rate with that therapy. And so if you're willing to go through the therapy, it's a very potent tool, and the other blessing is that it's covered by insurance. And so no downside other than the time required for the therapy. The other reason is laser therapy. We use MLS laser therapy for neuropathy on some patients. It's not covered by insurance, but it's a modality that most clinics don't have because the machine's quite expensive. So we have that as another, I guess you'd call it another bullet in the gun to treat neuropathy. The final thing is nerve decompression surgery. About 30% of people that have neuropathy have some degree of nerve compression that's contributing to that. And there are ways to diagnose that are fairly specific, and if you're careful and you use the appropriate diagnostic modalities and you're a candidate for that kind of treatment, that's a wonderful treatment because it reverses a major cause of the neuropathy. For example, diabetic neuropathy, most people are unaware that in diabetes, if you have uncontrolled diabetes, your nerves actually get about twice as big around as they would normally be. So they're big fat nerves and they have to travel through little tiny tunnels. And so if you can get the tunnels opened up so the nerves aren't being compressed, then the nerve feels better. So we're pretty, I would say we probably do more nerve surgery in our clinic than any place in South Texas. We do a lot of nerve decompression procedures, and we have a pretty, I'd say 95% success rate with that therapy in our patients. Some people fail because probably they've been compressed too long and the nerve just simply can't recover. But we have great success with that. It's been proven over and over and over again in clinical studies, and we're pretty expert at that kind of procedure, at not only diagnosing it, but also doing the surgery to treat it. A lot of the problem is most people don't know how to diagnose it, so we put a lot of effort into that. So that's why I think you ought to choose us for neuropathy. I think we can help you out and make you feel a lot better. Thanks for listening.